Hi, I'm Shannon Daniels and this is my Unit 20 Human Immunity presentation. All of the information in this presentation have been from the EPEL study materials or from my own knowledge of working as a HA and phlebotomist in a hospital and lab environment. The presentation is in 4 sections, so let's go on. Firstly, we'll be doing section 1 on non-specific defences. So non-specific defences are those that do not distinguish between one type of pathogen to another and respond in the same way. Non-specific devices present in the human body from birth, and non-specific immune systems include phagocytes, complement proteins and cytokines. Now we're going to speak about how the skin acts as a barrier and the role of inflammation. So the skin forms part of the defence system called the integumentary system. This system also includes the hair, nails, skin and the skin. The skin has 3 layers, which are the epidermis, the dermis and the subcutaneous layer. The skin is the largest organ in the body and it's his body's first line of defence against infections. The epidermis, which is the outer layer, forms a waterproof protective coating so that bacteria, parasites and viruses cannot get in unless the skin is broken. So the epidermis, the top layer of skin, obviously things can't get in and out of your skin, like we're not leaking blood all the time, so it's the body's best way for things not to get inside. And you'll notice as well, to stop your skin from drying out and becoming damaged because of the dryness where it's been like chapped or something, when you wash your hands in like a sterile environment such as a hospital, it will have the soap, then it will have like your antibacterial gel, and it will also have a moisturiser as well to stop your skin from drying out. The role of inflammation is to help the body heal when illness or injury causes damage or infection. Although cases of inflammation may be uncomfortable or even painful due to swelling and throbbing, it's a necessary part of the healing process. The function of inflammation is to eliminate the initial cause of cell injury, clear out dead and injured cells and tissues and damage from the original injury. Inflammation can be either acute or chronic. So what happens during inflammatory response is the inflammatory response is an array of cellular events that is a major component of the innate immune system's response to damage or infection of the skin. Your skin contains Langerhans cells. These Langerhans cells are a very important part of your immune system. If they sense that harmful bacteria has invaded the skin, they release a chemical signal that attracts white blood cells to the area of your body to fight off the infection. Your skin becomes red and swollen as the chemicals released by your skin Langerhans cells attract many other immune cells to fight the infection and extra blood to nourish the injured tissues. This increases blood circulation around the affected area and causes blood vessels to dilate, which causes the swelling and throbbing. So now we're going to speak to barriers to infection from the orifices in the body. So a body orifice is an opening in the body, so basically anywhere that a parasite or a bacteria can get in, so the eyes, ears, nose, sinuses, mouth, throat, the respiratory tract, the urogenital tract and the vaginal tract. So mucous membranes line each of the above in order to protect them from the external environment. Typically, mucous membranes are coated with secretions that fight microorganisms and form an effective defence against infections. So, for example, the mucous membranes of the eyes are coated with a bathing tears, which contain an enzyme called lysamine that attacks bacteria and helps protect the eyes from infection. So the overall effectiveness of the barriers to infection via body orifices are very effective natural barriers, and the immune system defend the body against organisms that can cause infection. Natural barriers include what we just discussed and are the body's first defence. Again, these include the skin, mucous membranes, tears, earwax, mucus and stomach acid. Also, the normal flow of urine washes out microorganisms that enter the urinary tract. So for the female genital tract and the urinary tract, there's a number of very effective barriers to infection. So the bladder is protected by the urethra, the tube that drains urine from the body. In males older than around 6 months old, the urethra is long enough that the bacteria and a cell are able to pass through it to reach the bladder because of the frequent movement of urine from the bladder out of the body. In females, however, the urethra is a lot shorter than in adult males, and as a result does occasionally allow external bacteria into the body, although in both sexes urinating does flush out the bacteria. So, and then along with that, the female genital tract, the vagina contains lactobacilli. These are bacteria that metabolize glycolin in cervical secretions forming lactic acid. The pH of a healthy adult's vagina is around 4.5, and the acidity of the vagina prevents harmful bacteria from growing and helps maintain a number of protective bacteria. So in a woman's vagina, they have also got a lot of healthy bacteria. So for instance, when a person is taking antibiotics and it's killing off all the bacteria in your body, sometimes it can flush out the healthy bacteria as well, and then a woman can sometimes end up with thrush. Now we're going to speak about the roles of the thymus, the lymph nodes and the lymphatic ducts. So firstly, the thymus gland is the main organ of the lymphatic system located in the upper chest. The thymus serves an important part of development of T lymphocytes, so T cells. These are extremely important types of white blood cell within the body. And we've got lymph nodes, so we've got the structure of lymph nodes here. The main function of the lymph nodes is the filtering of lymph to identify and fight off infection. In order to do this, lymph nodes contain lymphocytes, a type of white blood cell which includes B cells and T cells. These circulate through the bloodstream and enter and reside in lymph nodes. And then lastly, the lymphatic ducts. So the human body contains two types of lymph ducts. The thoracic duct and the right lymph duct are both parts of the body's lymphatic system. They work in conjunction with lymph nodes and other vessels to circulate disease-fighting lymph throughout the body. A lymph duct specifically moves lymph from various bodily tissues into blood cells. So the thoracic duct runs along the abdomen to the neck, and then the right lymph does the same, but obviously on the right side of the body. And now we're going to speak about macrophages. So a macrophage is a large white blood cell that is an important part of our immune system. Macrophages are born from white blood cells called monocytes, which are produced by stem cells in our bone marrow. Monocytes move through the bloodstream, and when they leave the blood, they mature into macrophages. They live for months, patrolling our cells, organs, and keeping them clean. A macrophage removes pathogens and foreign objects from the body by a process called phagocytosis by destroying them. The membrane of the phagocyte surrounds a cell to be engulfed, so basically it, and then pinches off to create a phagosome inside itself that contains an engulfed material. The cell then breaks down using enzymes. Now we're going to move on to section 2, which is specific immunity and immunity response. So acquired immunity is not present at birth. It is learned as the body grows and develops, as a person is exposed to the natural environment, as the body's immune system encounters antigens, foreign substances. That the acquired immunity is essentially a learned response from the body's immune system, determining the best way to attack each antigen and begin to develop a memory for that antigen. When the immune system detects a foreign antigen, it stimulates the body to produce antibodies that remain in the body and attack and destroy the specific antigen when it invades the body again. So when you say, for instance, when you get the chicken pox for the first time, it's very rare that you will get the chicken pox a second time, and if you do, it's not as bad as it was the first time, as your body already knows how to respond to them and how to fight them off from the memory cells that it created when you first had the chicken pox. So now we're going to speak about the roles of the different types of immune cells. So the neutrophils are white blood cells that play a very important role in our immune system. They circulate around our body in the bloodstream, and when they sense signal that an infection is present, they are the first cells to migrate to the site of the infection to begin killing the invaded bacteria. These blood cells make up approximately 40 to 60% of the white blood cells in our body. They function by attaching to the walls of the blood vessels, which is the effect of attempting to block the access of germs to the bloodstream through a broken area of skin. They act by means of a process known as phagocytosis, or some people call it cell eating. And then we're going to speak about lymphocytes. So lymphocytes work alone, while others are able to coordinate with other cells. The various functions allow them to properly respond to the foreign invaders in the body. Lymphocytes are the cells that determine the specificity of the immune response to infectious microorganisms and other foreign substances. And then B lymphocytes make antibodies, which is one of the final steps in disease resistance. When B lymphocytes produce antibodies, they make memory cells, like we just spoke about, that remember a previous infection by a specific pathogen, which means if the infection reoccurs, the body knows how to fight it off, such as the common cold or chicken pox, like I just mentioned. And then monocytes. Monocytes are the biggest type of white blood cell in the immune system. Originally formed in the bone marrow, they are released into our blood and tissues when certain germs enter the body. They quickly rush to the site for attack. Monocytes help other white blood cells remove dead or damaged tissues, destroy cancer cells, and regulate immunity against foreign substances. Now we're going to speak about the types and function of immunoglobulin. So the immune system is in a healthy person produces 5 main classes or kinds of immunoglobulin, which the structure are here. So there's 5 different types. So it's IgA, IgD, IgE, IgG, and IgM. So IgA is found in the lungs and the gastrointestinal tracts, which is the stomach and the intestines, and the genitourinary tract. It is present in the saliva, tears, sweat, and nasal fluids. It is important in controlling infections in these parts of the body. It can also act as an anti-inflammatory immunoglobulin, and it is important in preventing the body making an immune response to foods and friendly bacteria. And we've got IgD. IgD is important in the development of the B cell, which produces antibodies. It is not found in the blood or tissues. Then we've got IgE. IgE is the largest immunoglobulin and mainly occurs in allergic response. Hay fever is a condition caused by too much IgE activity. Then we've got IgG. So IgG is found in the blood and gets to nearly all parts of the body to attack and kill most bacteria. IgG is the only antibody that can cross the placenta and provide immunity to the fetus. Then we've got IgM. IgM is a rapid action antibody that is produced when the body is attacked by a bacteria or other bug that the immune system has never met before. It can be produced more quickly than the other types of immunoglobulin. That was all types, all 5 types of immunoglobulin. But now we're going to speak about the rejection of transplanted organs. So a transplant is obviously when one person transplants their organ to another person, such as the kidney, heart, lung, or pancreas. So that they're replacing the damaged organ with a healthy one from a donor. When a person receives an organ from someone else during transplant surgery, the receiving person's immune system may recognise that the new organ from the other person as foreign. This occurs because the person's immune system detects that the antigens on the cells of the organ are different, and the new organ is recognised as being non-self. Organs that are not matched closely enough to the recipient can trigger a blood transfusion rejection or a transplant rejection. The likelihood of rejection can be reduced by closely matching both the organ and donor more closely. The more similar the antigens are between the donor and the recipient, the less likely that an organ will be rejected. Monoclonal antibodies can be used during and after surgery to knock out the specific T cells which cause the rejection of the organ. If these medicines are not used, the body will almost always reject the organ. No two people have got the same antigens except from identical twins. So if an identical twin gives the other twin their kidney, then 99% of the time the transplant works, and there's no rejection at all, almost never. So the types of rejection, there are 3 types of rejection to transplant. So there's hyperacute rejection, which occurs a few minutes after the transplant, and this is when they've been badly matched, so there's no similarities at all, so they're completely different. The tissues must be removed right away. This type of rejection is seen as a person is given the wrong blood type when having transfusion and can result in death. An acute rejection may occur any time from the first week after the transplant to 3 months afterward. All recipients have some amount of acute rejection. This is why the medication containing the monoclonal antibodies is used. And then we've got chronic rejection, which takes place over many years. The body's constant immune response against the new organ slowly damages it. So the transplanted tissue or organ gets damaged over time with that one. Now we're going to speak about why the human immune system does not attack its own cells. So the human cells usually display specific types of antigens which the immune system recognises as being self, which the body uses for its own purpose. When the immune system encounters the antigen of red blood cells on its surface, it will not attack it or signal it to be attacked because the antigen recognises it as self. When the immune system encounters an antigen that has not been seen before, will be recognised as non-self and by the innate immune system, the adaptive immune system being T cells, and then they will respond to it as they need to. Now we're on section 3, biology of vaccination. So vaccination involves the body immune system being exposed to a weakened and harmless version of the pathogen in order to boost up the immune system. There are 2 types of active immunity, so it's active natural immunity and active artificial immunity. The scientific factors influencing immunity provided by a vaccine. So the 3 main factors influencing the effectiveness of a vaccination, and these are host factors, vaccination characteristics, and match to circulating strains. So host factors are things such as age. So once a person becomes over a certain age, the body doesn't take to vaccinations very well because their immune system isn't as great as a younger person. Vaccine characteristics are things like if a person who is already unwell gets a flu jab, the effectiveness of the flu jab won't be great because the body's already fighting off one infection, so it can't devote its full attention to the flu jab because it's already preoccupied in a sense. And then a match to circulating strains is there are obviously all different kinds of flu, so scientists need to match to the flu that is going around in circulation in order for the flu jab to work. If it's a completely different flu that you've been vaccinated for, the effectiveness of the flu jab will be 0 and you'll still get the flu basically. So vaccine safety, so testing is a crucial stage in development and the use of safe and effective vaccines, top safety testing procedures. So there are 3 phases in the testing. Phase 1, if a vaccine passes the pre-medical clinical assessment, then it can go on to phase 2. If it doesn't pass the first stage, then it will just be abolished. Phase 2 is when the vaccine is administered to a larger number of recipients usually around 25 years of age, so that it can respond better to a more effective immune system. And then phase 3 is the clinical trial to process aims to demonstrate both safety and protection against the target. Thousands of people would be involved in this one. And then when the vaccine has been approved, there are lots of safety procedures in that. So even myself, in like a hospital environment, all the vaccines will be like in a fridge, and it has to be at a certain temperature. So there'll be a digital thermometer and like a manual thermometer inside the fridge as well, and them two have to match at all times. The vaccines are not allowed to be touching any surfaces of the fridge because those bits will be too cold. You have to check the dates and the batch numbers and make sure that they're all correct. The dates that are closer have to be put to the front so that those ones are used first. It has to be cleaned once a day. It's all very strict. Now we're going to speak about herd immunity. A contagious disease is one that's spread directly from person to person. When the majority percentage of the population is vaccinated, it's more difficult for contagious infectious diseases to spread. And then the effectiveness of the following 3 vaccines, so the flu vaccine, the MMR vaccine, the hepatitis B vaccine, are all very effective, especially the MMR vaccine in regards to CRS, which is now very rare in the UK due to the vaccination. And then we're going to go on to section 4, which is how the immune system may cause ill health. So your body's immune system protects you from disease and infection. If, however, you have an autoimmune disease, then your own immune system will mistakenly attack healthy cells in your body. And then we're going to speak about reducing the risk of allergies. So there are 2 different types of allergies: food allergies and then environmental allergies. So food allergies will be like for like nuts or seafish or something like that. So in order to reduce the risk of those, you need to check labels, ask people who have cooked your food exactly what they've put in them, and people as well wear like a pendant or like a ring or a bracelet with what they're allergic to, especially people with nuts. And then environmental allergies would be like from like dust mites or something like that. Mold can set this off, so you need to make sure the cleanliness of your home, constantly dusting, and also to keep pets off your furniture and to control mold. Don't dry clothes indoors and use air filters. And that's the end of section 4, so we're all done. I will attach a copy of these slides as well for the assessor. Thank you for watching.